listening to 1059 The Region, and this is Health is Wealth with Dr. Mike Carrozza. I'm station manager Tina Cortez. Dr. Mike, how are you managing your office and your patients as we begin this month of June?
So it's a challenging time because it's a different picture. I mean, the healthcare profession as a whole is I think is going to be changed permanently. I mean, lots of things are going to get changed. Lots of things are permanently different. I mean, we're just unfortunately we're not going to be able to treat patients the same in terms of what we are normally conditioned to. I think now, I mean, whereas we were able to see maybe 20 to 30 patients in a day, they're going to have to get trimmed down, and there's strict guidelines and policies in place that are going to have to be looked at in terms of the overall care in the center, and to take into consideration not only the patient's best interest, but other employees and healthcare professionals alike within the same space. So I think things are going to be a little different, but the good news is that, I believe things are going to get back in place with certain care, but, taking the proper measurements, and screening the proper patients as we come close to the middle of the summer, but hopefully this will be a thing of the past, and then we'll hear this COVID-19 recording sometime 5 years from now and say what was that all about, right?
For sure. And Dr. Mike, can I ask you then, in terms of, you said your patient numbers on a day-to-day basis, they're obviously going to have to change. What about the physical environment of your clinic? Is AppleMed going to look different? And what about the folks your colleagues, those that you work with in the office on a day-to-day basis? How is that going to change?
Yeah, so I mean, we're looking at this right now, and I think the guidelines are out. We're seeing the preliminary guidelines, and they're actually out. They're saying that, everybody's got to be 1 to 2 meters apart. There's no more like, hey, man, want to have lunch together in the back room. And, practitioners, I have another associate in the office, Dr. Ryan Shakitano, like he's, we're both, we work together, but I mean, when he's on, there's no point in me being on. So it's going to be like scheduling things accordingly, which we already are doing. And believe it or not, it's working out well. And it's just going to be scheduling, and everybody stick to their own space. The lovely part about our clinic is that we have a large space, and we have like 11 treatment rooms. And each treatment room is there's a lot of space between each treatment room. So the one thing we have to sort of control is, how many 9 o'clock appointments can you have versus, let's say, for example, if if Dr. Ryan had a 9 o'clock, I had a 9 o'clock, and the massage therapist had a 9 o'clock, and the physiotherapist had a 9 o'clock. And so we would all have these 9 o'clock appointments, and we would sit in a waiting room, whereas we can't all have 9 o'clock appointments. We can't have, every single person walk through the front door at the same time. So I think staggering the appointments is going to be instrumental. It's going to be clear, and by 15 or 20 minute intervals, and then screening the patients. And then, I think gone is the doctor being late and maybe having the patient just roasting in a waiting room. Although our waiting room is quite lovely and we have a nice water fountain and it's quite serene and people actually like to wait in our waiting room, I think those days are over. I really do. And I think people are going to be like, call me when the time is there, and then we'll come in, or maybe they'll wait in their car. And I think that's most likely how things are going to go.
And I think you mentioned this in our previous show, that we have to be careful about those around us who are the invisible risk, right? Or those around us who might be immune compromised that we don't know. Those around us who are walking around asymptomatic, for example, right?
Yes, no, that's for sure. Because it is, first of all, I mean, we mentioned this in our last segment. This is the reason why we ended up all staying home. I mean, the majority of population, believe it or not, the majority of the population is quite healthy and can combat this. And it shows that above the age of 60, between the age of 60 and 70, the people are getting hit with this the most, and the immunocompromised, right? So, and then the invisible at risk, which we're going to speak about a little later. And these are the individuals that are maybe on some serious, immunomodulating drugs, and that can actually be really hit hard with a virus like this. And so, this is a concern. And then you have the asymptomatic shedders and the people that are still going to be contracting the virus and maybe feel fine. And so it's interesting. I mean, I had somebody call the office, said, I need to come in, I need the treatment with the chiropractor. And so we have a screening process. And he said, I just developed a dry cough. Well, unfortunately, if it walks like a duck and talks like a duck right now, it's a duck. So, you had a cough. You have a sore throat, not a good time right now. Unfortunately, we can't see you. So these are the screening processes. But some people are going to fly under the radar. Some people we're not going to actually, detect, because we'll ask them, do you have a runny nose? Do you have any pink eyes? Now, I think a big one as well. Pink eye. Do you have any loose bowels? Any sore throat, any cough, any fever? And we can do our checkpoints and they can come through our office. And that's just to protect us. But the fact remains, somebody might come in through the office completely. So I think wearing a mask and gloves is going to be actually instrumental right now. I think in public, I think Trudeau also mentioned, he's going to be on Parliament Hill with his mask. I think it's important. I think a lot of people are going to be in society right now with masks, especially inside a closed facility. And I think that's the best, because it's going to protect the practitioner for possible, and then it's also going to protect the patient. So it just protects everybody.
Absolutely. And it was our medical officer of health a couple of weeks ago who said, across the board, masks are what you should be using if you cannot physical distance. So that will be our new normal. After the break, Dr. Anderson is back with his research on IV therapy. This is Health is Wealth on 105.9 The Region. Stay with us. You're listening to 105.9 The Region, and welcome back to Health is Wealth. I'm Station Manager Tina Cortez, and over to Dr. Mike with today's guest.
Well, thank you, Tina. So welcome back, Dr. Paul Anderson. He's back on the show, and a true inspiration to not only myself and fellow naturopathic doctors around the country. I mean, in terms of his work. Dr. Paul Anderson, welcome. I know you've done a lot of research. You've supported a lot of us in terms of when I was in medical school, and you came to do several lectures and taught us a whole bunch and a wealth of knowledge. So thank you again for coming on the show.
Thanks for having me.
Now, we know in terms of your expertise on immune health, and specifically, I want to talk about intravenous vitamin therapy because it's one of my specialties, and I know it is one of yours as well, thanks to you, of course. But, I want to focus a little bit of attention on IV vitamin C. I mean, it's getting a lot of traction right now in the news. A lot of people are talking about it. And, of course, there's even some published papers, one in which that you've helped publish. But I'd also like to mention to our listeners, there's a wonderful book that I've read. I know you wrote a couple years ago, but you got another one coming out, and it's Outside the Box Cancer Therapies. Yeah. And it shows quite promising data and research on specifically, IV vitamin C. And just would like to just talk to you a little bit about intravenous vitamin C, and specifically about, let's talk about cancer a little bit. I know that's a little bit of your expertise, but I want to talk about how vitamin C really works, and if you can help our listeners explain that.
Yeah. The shortest version of a real long story around IV and IV vitamin C, and then getting to cancer research with it, is I was doing that sort of IV therapy, IV nutrients, IV vitamin C, et cetera, in private practice for many years, and using it with cancer patients, people with immune problems, et cetera. And in 2009, I think, or 10, Bastyr University, where I was faculty, started a cancer research with the U.S. National Institute of Health, so a federally funded cancer research. And part of what they did was to include an IV therapy component. And so I was full-time there as faculty, and they recruited me for that because it's a lot of technical, as you know, a lot of technical things to know when you're doing IV therapy. So we did that. And a lot of what we did was IV vitamin C. We did a lot of other IVs as well, 5-year study. And then after that, I went back into private practice and was helping with the research. So when this whole, if you remember back to last year, there were some things around sepsis and vitamin C in the hospitals. And then with COVID, the Chinese started to use IV vitamin C with their bad patients in the hospital. All of a sudden, then a group I work with, the International Society for Orthomolecular Medicine based in Canada, had me do an international update on vitamin C because I had all this other experience. And so I got paper contact with the Chinese doctors, found out what they were doing. And basically, it gets to a very important part about why vitamin C is important, and it's a little different than what we think, actually, as far as when we get to immune problems. And one of the things that's really critical is a lot of the things that we learn from cancer immunity and nutrients, especially vitamin C, is real similar to chronic bad viral immune problems and vitamin C and other nutrients. So it sort of all of a sudden all came together. And
so, Dr. Anderson, I want to pick up a little bit about what you were talking about. And in terms of vitamin C therapy, you are not suggesting that our listeners self-medicate, as your president has been doing recently, that you're not suggesting that vitamin C therapy is treatment or a preventative measure, are you?
Yeah. So no, nobody should self-medicate. And as Dr. Mike had mentioned, you need to speak to somebody who's a healthcare provider who's educated in these things. A lot of the GPs don't know anything about it, so asking them, you might as well ask your plumber, actually. So you need to talk to somebody who is trained in these things. Now, someone like Dr. Mike or an integrative physician, et cetera. But here, just to give a little bit of the rest of the story with China, the thing they ran into also was they realized they had to keep people out of the hospital, because it's great to have treatments in that help people, like we talked about. What they did there that was medically supervised was they had people at home take oral vitamin C, because they knew that the body wastes it every day, and to keep the levels up. But they had medical advice and supervision. So, yeah, you don't want to just go out and freestyle and just get a bunch of stuff and take it, because if you're on medications, there might be some things that it doesn't work with, etc. But under the correct amount of supervision and help, a lot of these things can be very useful on the preventive end, and that's what they've shown in China for sure. So no, we don't want people self-medicating. I don't know, Americans are really, we're prone to that sort of thing, yes, but be careful.
Yeah, definitely be careful. Another point, though, I mean, on the notion of vitamin C, and as it's a preventative measure, and of course under the right supervision, but it's also inexpensive, and I think that's a key point. And I think
it's hugely inexpensive compared to every other thing that you hear about, pretty much. And I think because people will say, well, it sounds too good to be true, but biologically in humans, where we don't make our own and we have to get it from the outside, it does so many things for us, and when it's not there, it weakens us in so many places, that I think that's why it looks like it's too good to be true. But it's just your body needs it that much.
Exactly. And another nutrient that I think is really important that's related to vitamin C, and I want to bring to this chat about is glutathione. Glutathione is another huge one. I mean, it's we've heard about it in the literature, and especially things like the precursors to it, like NAC. But specifically, can you just make a quick mention for our listeners in terms of, I always speak about it on the show, but it's nice to hear from another practitioner like yourself in terms of glutathione and why it's like this huge antioxidant that's quite necessary in the body?
Yeah. So quickest description I give is inside of your water-soluble parts, like your plasma and your blood and the parts outside your cell that feed your cell, you have two antioxidants that primarily keep each other going, vitamin C and glutathione. And then there's some fat-soluble ones that are related. Glutathione, unlike vitamin C, your body can make glutathione, but it has to have the underpinnings to do it, like cysteine, the amino acid you mentioned. So we often will give people N-acetylcysteine orally with vitamin C. Again, very inexpensive, and it helps the body make it. But what happens is when you get really sick and you get very inflamed, not only do you burn up your vitamin C reserves, but the glutathione, which is also part of the antioxidant, anti-inflammatory cascade, gets used up. Even though you make it yourself, it gets used up. And the thing about antioxidants is they back each other up. So if the vitamin C goes low, the glutathione doesn't work as well. So yeah, supporting glutathione, supporting vitamin C, and all of the nutrients that support the two of them are just critical to stay well. But if you get sick, they're extra critical.
What happens when you put people in isolation indoors for a few months? All kidding aside, I mean, I know COVID's, right now the most important, but there's also other illnesses that are underlining that are probably going to be coming out, and we're going to get hit pretty hard in terms of our healthcare. Do you have any thoughts about that?
Yeah, the way I see it is because having been in Seattle and being sheltered in place for almost as long as any U.S. city anyway, I'm experiencing it and watching people and talking to people constantly. I think number one, it's a giant healthcare and social experiment that's going on. And we won't know. But the things that I see that are concerning are, isolation itself. If you're sheltered alone or something like that, is not good for your mental, emotional, system. That's not good for your immune system. And people talk about this, but I think it's a very real issue. We talk about, eating right and doing all this stuff. If you're not real careful when you're sheltered in place, et cetera, you're going to exercise less. You're going to tend to eat maybe more comfort foods, which rarely are good for you. People are day drinking. There, a lot of stuff just to deal with the stressors of what's going on. And so there's a lot of opportunity for not great lifestyle choices, let alone the isolation and let alone all the other things. So, my concern is, and of course, there's people who are being very cautious about this and, they're still working out and they're doing all this stuff, and that's great. But I think en masse, my concern is we're going to be kind of weakened when we come out of it. And then if something else blows through the wind, we're going to be a great target. Anyone who's ever, broken their arm or a leg or something, when you come out of your cast, like you have to rehab, right? Because you've been stuck, the muscles aren't working. It's kind of the same if you've been sheltered in place or quarantined. Unless you've been doing a whole lot to take care of your health, you might come out of it weaker. So I think that's we don't know yet what the impact is, but there's potentially a lot of health impact. Yeah.
And Dr. Anderson, for our listeners who missed the show last week, you're in Seattle. It was one of the first places to be hit by COVID-19. Where are you now? And in terms of battling the virus, and what do you think about the second wave that folks are concerned about as well?
Yeah. We were the first hospitalized case. We don't know about other cases, but so we've been on the front end of it. We are still sheltered in place with a little bit of opening for certain industries. People are getting around, but they're being cautious. Ultimately, I'll tell you what I really think about a second wave. Like statistically and historically, with a pandemic, there's never not been a second wave with this type of pandemic. How big it is totally going to depend on how much natural immunity we've developed, et cetera. And that's very, very important. My concern is like I was saying, it's sort of a grand experiment, and that's the best word I can come out with. We don't know where we're all going to come out of sheltering in place, all this stuff, whether that was a good or bad idea or whatever. Seemed like a good idea at the time. When we do come out, if there's not a native amount of immunity and the virus is still hanging around, there could be a moderate to extreme second wave. What we're watching in the U.S. is there are states down here that left shelter in place earlier than other states. Now, again, that's a human experiment that's going on, but we can watch that. If they don't get large bumps in new cases and deaths, that's so that bodes well for the rest of the country. But we don't know. We just don't know. And in Seattle, upside is, we're not doing everything like we used to, and not every industry is open here. But we have not had any signs of second wave. But we're also not terribly, mixing it up as far as human interaction.
Let's end up on a positive note. I just came in contact with a patient who's in her late 60s. Okay, she's diagnosed with COVID. I'm obviously helping her through telemedicine. And I gave her some advice, of course, because she is my patient, and she called me concerned. And she's doing well. She's on day 9 now. She had low-grade fever, never went past 38. She sounds pretty rough, not going to lie. But tired, fatigued, the old thing. She said she's got to sleep it off, but she's doing her thing in her routine, and she's coming through it. I mean, and the good news is, I'm sure you have some patients as well, Dr. A, in that, because it's that 60 to 70, which is that sort of, age group where it's getting really attacked. I mean, and the good news is there's some people that are really coming out of this, right?
Yeah. I think, we hear about the worst cases, which of course are tragic.
Sure.
But we certainly had a lot of those here. New York had a lot in Toronto, et cetera. But I have talked to more people now that time has gone on who have done supportive measures through the process. No, they don't feel good while they're, in the battle, but they're supporting themselves appropriately. And they come out the other side, and they do, number one, they don't die, but number two, they come out of it and they're back to pretty much normal. And just like the Chinese said in their expert panel, if you can do anything to keep a patient out of the hospital, they're more likely to live and survive. And that's the advice, line, that people like you and I try and go on is, let's do everything we can to keep you healthy. And yeah, being sick is no fun, but let's get you through it. And that a lot. Yeah.
Amazing. Well, Dr. Paul Anderson, thank you very much for coming on the show. Before we end off, please let our listeners know where they can reach you, connect with you.
Yeah, the 2 quickest contact points are going to be Instagram or Facebook, and it's DRA, like Dr. A, DRA online. On Instagram, it's just all that word put together, DRA online, and on Facebook, it's DR.A online. And then that has links to the papers we've talked about and the book and all kind of other fun things.
Yeah, and just a reminder for our listeners, the dietary and lifestyle changes and measures that we recommend on this show obviously should be reviewed with your professional, qualified healthcare professional. So either a naturopath or functional medicine expert, somebody who's skilled and qualified in this, as we are not recommending anything because we are not your doctors, but we are just bringing light to some of the research and what's currently out there.
And Dr. Mike, please remind our listeners how to connect with you.
And you can reach us at 905-417-4000. That's our number. We're here to support people. So obviously, you have some questions and concerns. Obviously, we're dealing with essential care patients only at this point in time. And feel free to email us at info@applemed.ca, or you can reach us on Instagram at AppleMed Clinic.
That's our show for this week. Previous episodes of Health is Wealth on 1059theregion.com.